Alright, we're going to be going over the key terms list of the axial skeleton, and we're going to be looking at the different orientations. Again, this is for AP120. So the first one that you're going to see here is the frontal bone. This is also the bone that's found in the majority of our forehead. So you can see all of this would be frontal. And then we have here's one side of it. Oh, terrible. There we go. So you can see this one would be our maxilla. Here's our maxilla. And then we have our cheekbones on either side, which are our zygomatic bones. We can see that this entire bone here is our mandible, which holds our lower teeth. And then we have our teeny tiny little nasal bones right here. We have two of them. And then we can't really see it from this angle, but if we look kind of in this direction, inside of the orbit, we can see this would be our lacrimal. This is a great view because it also allows us to see inside of the nostril, which we know there are going to be two structures here. The first will be this superior kind of plate. This is going to be our perpendicular plate of the ethmoid bone. It's a pretty long name, but it's the perpendicular plate of the ethmoid bone. The inferior part that's making our inferior nasal septum, which again is that kind of border, is called vomer. And together, again, they make that nasal septum, which divides our nasal cavity. Okay, so let's take a look at some other bones here. From a lateral view, we can see from this lateral view a bunch of different things. So let's start by talking about the temporal bone. So we're going to kind of outline it here. Okay, and the temporal bone, one of the first things that you can see is this opening. And remember, temporal is spelled like this. This opening allows for sound waves to go in. So you should be thinking, right, acoustic, that's for like acoustic covers. This is for sound. So this is called the external acoustic meatus. Posterior to the external acoustic meatus, so this direction, we have this bump here, which you can feel on yourself. This is the mastoid process. Here's our mastoid process. And then we also can see that we have a really sharp portion of the bone that's kind of over here, so you can kind of see it right there, right? This is our styloid process. So remember, think back. Where else have we seen this term? We saw it in the ulna and the radius. So this is our third time learning it here, but this is specifically of the temporal bone. Then as we go anteriorly, we can see like right about here, this would be our zygomatic process. Here's our zygomatic process connecting to our zygomatic bone, which again was our cheekbone. Okay, then we have this portion here. So if we look right here, this would be our mandibular fossa. Okay, our mandibular fossa connects to our mandible, and specifically it connects to the the mandibular condyle. Okay, there's a couple of cool things that we can also see from here. Remember we talked about the lacrimal bone. Remember if we zoom into the eye, which is this thing letting me zoom in? Let's see. Zoom into the eye right there. You can see there's this hole, right, like right here, right? So remember, tears will go down there into your nostril, and then you'll kind of blow them out. So if I was to outline this bone here, right about here, right, this would be our lacrimal bone. Again, allowing those tears to go away. We can also see from this angle, this suture right here is our squamosal or squamous suture. We can also see from this angle this right here, which is our coronal suture. Remember, like putting a crown on this guy, right? And this is the, basically it would be like a coronal plane. Behind here, we can also see another, just a little bit of it, right? But this would be our lambdoidal suture. Okay, let's keep going. So, one other bone that you can see from this same angle is that this specific bone right here, if I kind of outlined it, this would be our sphenoid bone. Right, and then the larger bones, right, we said this was temporal, this was our parietal, this is our frontal, and then back here would be occipital. Okay, let's see. This is a superior view and a posterior view of the skull. So this is also kind of showing us, right here we have this, also right here, this would be our coronal suture. And then behind here, you can see on both ends, this would be our sagittal suture. And then from a posterior view, you can appreciate the last suture, which is going to be our, again, lambdoidal suture. Cool. So then, again, this is just an animation again. So I'm just going to point these out. Again, we have frontal, we have parietal, we have occipital, temporal, sphenoid, we have our zygomatic here, we have our nasal, we have our lacrimal, our maxilla, and our mandible. Okay, so those are the majority of the bones that you can see from this angle here. Let's look on the inside. There's a couple of structures, and we're going to talk about them going from anterior all the way to posterior. So from the front to the back. And we're going to start off with the frontal bone, which is going to be right here. So this is all frontal. This is also frontal. But there's a specific portion in between, so right around here, that this is now ethmoid territory. Okay, so this is the ethmoid bone. And there are 3 structures on the ethmoid bone that you do need to know. 2 of them you can see from this specific kind of orientation. The first one is going to be, right, we should all see these little dots here. So you don't need to know what those dots are called. But if you were to draw a hypothetical kind of rectangle outside of those dots, kind of where those dots are sitting on, this is called your ethmoid, this is your cribiform plate. Sometimes it's called ethmoid plate. So this is cribiform plate. Then we can see there's this large kind of like, almost looks like a bump, right? So this is our crista galli. Crista galli in the middle. And then the other one we saw earlier inside of the nostril. Remember, that was our perpendicular plate. So let's keep on this image, and we can see now we're going to get into here. If I kind of outlined, right, this is the kind of smaller wings of the sphenoid bone. So all of this region here, a majority of it would be sphenoid, but there's one structure that you guys need to know, and it's found in this specific region here. Remember, this was that Turkish saddle. So right around here, we have our sella turcica. Then as we go posterior, right, this is now temporal bone region. Back here would be occipital. And then we also have in the center, one last thing that you can appreciate, which this is where our spinal cord will be going. shooting down. So this is our foramen magnum, this opening here. Okay, so again, let's take a look at it at the skull from an inferior view. When we do that, we can see a couple of structures, right? We can still see our foramen magnum. So I'll put FM for foramen magnum. We can see these bumps here on the occipital bone are our occipital condyles. Okay, all of this is still occipital bone. And then we know that this is all kind of posterior. Up here would be anterior. This is our upper row of teeth. So if we zoom in a little bit, so we can appreciate this a little bit more, if you kind of look at this line here, everything kind of in this region is your palatine bone, which makes up a portion of your upper roof of your mouth. All of this is all maxilla, but there's a little distinct region right around here. Before we get to our palatine bone, this region is called your palatine process. Remember, it's what comes into contact with your palatine bone, which is over here. Okay, let's keep going and let's see. This over here is our mandible holding our lower teeth, and it's pretty cool because we can see there's one structure that you need to know. This is your mandibular condyle. Okay, mandibular condyle is right there. And then again, this is our lower row of teeth. And then remember our mandibular condyle, if we zoom in, it sits within that mandibular fossa of the temporal bone. Right, so now we're going to go over vertebra. So we're going to talk about vertebra starting from the top. So this is our cervical vertebra. Then we have our thoracic. Then we have our lumbar. Then we have our sacrum. And then is our coccyx. Okay. So let's talk about the structures that we can see on the individual vertebra. So for those structures, right, so I think for those structures, for next week, you're going to have to know those, but we can also ask you, at least in my class, I can ask you to identify whether it's cervical, whether it is thoracic, or lumbar vertebra, depending on their size. Okay, so let's take a look at this vertebra. So here we can see there are a couple of structures that you're going to want to know. First of all is orienting. So this large structure is always towards the anterior side. Down here is always posterior. And this is our vertebral body. Then we have this opening here, which is the vertebral foramen. So again, vertebral foramen, it's right here. These outward projections here are our transverse process. And then we have this part here, which is the most posterior part, which is our spinous process. Okay, there's two more structures that you need to know. And those can be best seen from a lateral view. So this is looking at somebody's individual vertebra from a lateral side. So again, this was our vertebral body. We have our spinous process. So here's our transverse process coming outwards. There's two other structures. The one down here, which articulates with the bone, the vertebra below it. And then there's one up here. So this one down here is called your inferior articulating process. The one above would be the superior articulating process. Okay. So in addition to this, we also have to show you guys what would be a thoracic vertebra, right? Because right here, this has this new structure that kind of connects to your ribs. But we do also require you to know the first two individual vertebra, right? So that is your C1 and C2. And C1 looks a little bit funky because it doesn't have that really distinctive like vertebral body. It's almost like missing. And it's because of C2, which sits in that space, which you can see right here. So down here, right? So again, C1 is called atlas. C2 is called axis. So this would be C1, and then this is C2. And for axis, you do need to know what this bump is. This is the dens. Okay, so this is the thing that actually sticks up into C1, which allows you to kind of rotate your neck. All right, the last things to talk about are the ribs and the sternum. So in the sternum, which is right here, right, there's three structures. The first one is the manubrium. Then we have the structure right here, which is our body. And then down below, we have our xiphoid process. Xiphoid process. And then remember that the first 7 ribs are going to be your true ribs, and then everything else would be false ribs. So here's, if we count together, 1, 2, 3, 4, 5, 6, 7. All of these are considered our true ribs. So again, true ribs, where is it? 1, 2, 3, 5, 6, 7. True ribs. Then these are all false ribs. And then the last 2 here, 11 and 12, are specifically your floating ribs, okay? Because they're not connecting to anything. They're just kind of floating in there.